Welcome back. In the last segment, we told you about the causes and symptoms of major depression. Well, now we're telling you how to try and prevent it. Dr. Bradley Wajda with Esano Incorporated joins us once again with some tips. All right, thanks for sticking around, Dr. Wajda. Can depression be prevented? We were talking a little bit during the break about the things that we can do, which maybe include looking in the mirror and smiling to prevent feeling depressed.
Well, exercise, good sleep habits, certainly avoid substance abuse. There are so many substances that are abused that are depressants themselves.
That a lot of people use because they feel it's going to make them feel better.
And they use it as a chemical coping skill, and they use it as an escape, and even if it's a stimulant, there's a downside to that, because when the stimulant wears off, then there's a crash. Then those mood issues are complicated by the withdrawal from the stimulant. But you know, if you engage in pleasurable activities, you know, take some time for yourself. Do some things that you enjoy doing. Surround yourself with positive people and socialize. Those are things you can do as a preventive measure. But of course, once depression actually starts, at that point, you do need to seek treatment.
When does it become a chemical issue? Because you mentioned that during the break as well, and I think it's important to point out that it is a chemical issue that we're dealing with depression, major depression at least.
Well, absolutely. It starts out, again, it can be a sad reaction to a life circumstance. But the emotions that you experience are still mediated by chemicals in your brain. And if that chemical pattern persists long enough in the brain, that's where the old phrase chemical imbalance comes in. And that's why early treatment is so crucial, because early treatment, then you have a higher success rate, particularly with psychotherapy, which is the talk therapy.
Okay, so let's talk about that a little bit. Early treatment. Does that involve medication, or does it involve therapy?
Well, it's a combination of whatever's determined to be best for you. Okay. I probably only use medication 50% of the time when I first see someone. You know, I will refer them to appropriate psychotherapy. And that's after we've done a complete evaluation. Now, that can include a physical examination, laboratory work, in addition to the interview, again, because there are many medical problems that can cause depression.
So you can tell whether or not a person is depressed by a physical exam and lab tests?
Well, again, let's take the example of thyroid illness. If you have a low thyroid, you can present as a classic major depression. And well, unfortunately, I've seen many cases where that was never considered. They were just labeled major depression, put on medication. Oftentimes, it's after a lot of expensive treatment that you find out a very inexpensive lab test discovers that it's a low thyroid, and even a more inexpensive medication corrects it.
Wow, I've heard a lot of women suffering from low thyroid or thyroid issues. Are there advanced treatments then that can help you deal with depression?
And
aside from medication?
I was going to say, in those times when that combination of medication and psychotherapy aren't successful, and I mean, let's face it, there's a small group of patients that have what's called refractory depression. It's treatment resistant. Then you have to consider other alternatives, and that can include literally shock treatment, and that conjures up a lot of negative connotations in people's minds, but nowadays it's actually a very uncomplicated process, not used a lot in California, certainly a lot more back east. Vagus nerve stimulation, which, just very briefly, if that sounds really strange, the vagus nerve is a cranial nerve that actually has roots that run all the way down into the chest. And so it has been discovered that you can implant something surgically to stimulate that. and it will then affect mood centers in the brain and help treat depression. And then the other one is repetitive transcranial magnetic stimulation, which is just using magnetic fields to stimulate those centers of the brain that affect mood.
Well, it's certainly good to know that there are treatments for whatever level of depression one might have. EsanoHealth.com is the website to find out more information about Dr. Wajda. And I know last time you were here, you mentioned something about moving. Do you have another location? You had one here in Fresno, up in the North Valley. How many locations do you have here in Fresno now?
Well, now, today is moving day.
Oh.
So today, as of today, we're at Fruit and Herndon,
Okay.
and we still, of course, have our office in Merced at R and Olive Street.
Okay, and the number to the Shaw, you're still in, or the number to the Merced office is area code 209-384-0800, and the one on Shaw is 999-9514. And you can also, if you are feeling depressed or need to talk to somebody right away, there's a suicide prevention line at 1-800-273-8255. And next time you come, you'll give us the number to your new office.
Oh, absolutely.
All right. Happy moving day, and thank you
thank
for
you.
all that great information. Give Dr. Wajda a call, everybody. So important. Thanks again. Have a great weekend, Dr. Wajda. Stay tuned, everybody. Central Valley Today. We'll be right back.